Hi everybody, welcome to the next Reset and Revive panel discussion with Alliance Healthcare in association with Alphega Pharmacy. So our next discussion panel has got the following title: How can technology be utilised to support the workflow in my pharmacy? So like the last discussion panel, we've been asking our pharmacy members and pharmacy customers what they want us to ask for our esteemed panel today. So without further ado, let me ask each of the panellists to introduce themselves.
Hi, I'm Kevin Murphy. First and foremost, I'm a superintendent pharmacist for Wellbeing Pharmacies Group. So my background is setting up new pharmacy contracts. We've opened around 15 in the last sort of 10 to 12 years, and that's led us on to thinking about how we can innovate in our business and innovating and founding our own automation company in around 24-hour collection points called MedPoint.
Hi, I'm Louise Laban. I'm working for Centred Solutions, and we are experts in repeat prescription dispensing services and automation. A little bit of history about myself. I think I'm the only one on the panel who isn't a pharmacist today. I've worked in marketing and sales in the pharmacy industry for over 10 years now, and then prior to that, public sector and private sector. So yeah, happy to be here today.
Hi, I'm Mandeep Mudda. I'm head of Alphega UK. I'm a community pharmacist. I've been a registered pharmacist for most of my career, and I've worked for most of my career in supporting independent community pharmacies to prosper, to continue to grow their profitability, and to provide patient services. I've been with Alphega just under a year, and I'm pleased that my team and myself continue to support over 1,000 independent pharmacies in the UK to run their pharmacies profitably and deliver patient services.
Okay, so our first question now to our esteemed panel today. So we've got a really good question. I think, Louise, this is probably a good question for yourself, if I may. So if I read out the question, and if you can have a think about it, that'll be great. So the question is, I'm getting confused with all the different types of pharmacy automation out in the market. So I know I do. There's quite a lot of pharmacy automation around now. So what are the broad categories available? Mm-hmm. And the follow-up question to that is, what are the pros and cons of each type? So if you could take that would be great, Louise.
Yeah, of course. Yeah. Technology is always evolving, and there are so many new solutions coming to market all the time, particularly in the UK. Broadly speaking, there are four main categories of automation. And each one of those automates a different part of the pharmacy workflow. So I'll run through those very quickly now. So the first one, probably commonly known as robotic dispensing systems. So this is about the storage and retrieval of original pack and the dispensing of original packs. The next one is around MDS automation. So this is the automating the assembly of blister packs. More recently, I'm sure Kevin will mention this later, there are patient prescription pickup points or kiosks like MedPoint offer. And then perhaps even more recently than that, there is automation for repeat prescription dispensing services, commonly known as hub and spoke. But when I'm referring to them, I'm not talking about perhaps the traditional model of hub and spoke, which is about huge warehouses with tons invested, in equipment and only really appropriate for the larger groups. I'm talking about new technology that's coming to market, which is empowering independent and multiple pharmacies because it's scalable, affordable, and accessible. So I suppose when we're talking about the pros of automation, I would say that one of the biggest pros of automation is it enables you to drive revenue in the pharmacy. So it frees up pharmacy time from those really manual administrative tasks and enables pharmacists who should be working at the top of their clinical license rather than doing these administration tasks to look at providing other clinical services to patients and to the community. It can save money. So if you look at our technology in particular, we reduce the stock holding sat in the branches. We stop over-ordering at the branches, which we all know happens. And by centralising some of that purchasing, you get the powers with that as well. And then finally, I think technology, it helps eliminate error. Unfortunately, when humans are involved, there is a natural rate of error. When you invest in technology and you put it in correctly, then what you start seeing is the verifications and the checks that technology provides. You start seeing a reduction in the number of errors. There are cons. Automation technology isn't right for everyone. It just isn't. If you're thinking about establishing a hub, for example, you have to have a physical space requirement. And that's a luxury in community pharmacy in the UK. But, you know, there are options out there for everyone. So, you know, you might start with a relationship with a wholesaler like Alliance, where you get patient-specific totes delivered directly to your pharmacy. And what this does is take some of that dispensing administrative work out of the dispensary, or you might establish a hub. So there are lots of different you know, options and opportunities. So I would probably say explore what's out there. Automation isn't right for everyone, but actually there are a lot more options than there were a few years ago.
If I may just ask a follow-up question to that.
Of course,
are
yeah.
you finding there's more and more pharmacies contacting yourself at Centred or in general interested in automation as opposed to maybe 5 years ago?
Definitely, because, you know, the technology on the market now has moved on and the world has moved on and technology moves really fast. So now it's not just about the big groups having these powers. This is about, you know, pharmacies as few as 2 or 3 coming together and, you know, and being able to establish a hub or being able to automate parts of that workflow to free up their time and to and to give them more time with patient care.
No, good. I think it's really useful you've segmented it into 4 key areas, which is quite useful because, again, 5-10 years ago, I probably only knew about the robotic original pack dispensing bit.
Absolutely.
But actually, I say there's at least another 3 categories now which pharmacies can have a look at.
Yeah.
So, okay, thank you. Louise, thank you very much for a really comprehensive answer. So I think, Kevin, you wanted to sort of build on some of those answers and give you a bit of your experience, don't you?
Yeah, no, definitely. I mean, when I was thinking about automation, I actually want to challenge the whole concept of what automation is, because it's not, for me, it's not actually about just machines. I mean, I know everyone thinks of automation and they think about a robot and it's 100 grand plus investment. But like Louise said, it's not, the technology's moved on. It's not that. There are more entry level ways of automating with machines like hubs and 24-hour collection points. But actually it's kind of almost a mindset. We need to be thinking about all the workflows in our pharmacies and automating bits of it. So what I mean by that is things, you know, step back and observe how your pharmacy is operating, and you know, things around how you check your prescriptions. We've got ERDs, you know, which we're not really growing as much as we should, and they actually lend themselves to automating, in a way, the clinical check, which is the really big bottleneck the pharmacists have. So using barcode technology to track your scanning, accuracy checking. There's an argument to be had about clinically checking prescriptions over and over again that haven't changed. So that's automation as well. We're stripping out tasks that don't need to be done. So that's a big one for me, to change the actual mindset of how we look at automation and don't assume it's a big expensive machine, basically.
No, that's good. Have you got any examples of what you've used into automation wise in terms of your pharmacy chain? Have you done anything specific that's really helped?
Yeah. I mean, we've looked at what time is getting wasted and what we can do more efficiently. You know, I would include loads of things into automation. So we now scan our bags into storage locations. So even in the orders that don't go into a collection point, when they go on the shelf, it's barcoded into a location that automatically sends a text message to the patient to let them know that it's ready. So it saves the manual task of somebody sending a text or whatever notification. So that's automation to me. It's automating part of what goes on or what needs to go on in the pharmacy. We're trialing digital clinical checks. Again, this stuff needs to be supported by the PMR system's functionality, and that needs to, you know, keep up with the other changes that are happening regulatory wise, and support pharmacists to do that. But that's a big time saver for pharmacists as well, to free up their time so that they can do all this wonderful other clinical services that we want to do, but we have to tear ourselves away from the dispensary bench, basically, and we can't just keep hiring extra pharmacists. We have to figure out a way of doing the dispensing efficiently while also doing the services.
You touched upon PMR systems there, actually, that they have to move with the times as well. Are you finding they are, or you think they're coming and...
Yeah, they are now. I mean, it's been a massive frustration of mine over the years how slow the development has been, and like every market, they need a bit of competition, and there is some new competition in that market, and that's healthy. That's good for us as customers, as pharmacies. So they're starting to innovate more recently to try and, you know, keep pace. So that's good to see, and we need to guide them in that in terms of telling them what we need as a customer, and use it as well, because there's so much functionality in PMR systems that pharmacies don't actually realise is there, and they're already paying for it, but not actually using it effectively.
Yeah, no, I can concur definitely. when I worked in the pharmacy, there's lots of functions about missed NMSs, for example, in England, which I know some pharmacies don't utilise. So thank you very much for that, Kevin. Appreciate it. Okay, so our next question that's come from the field really is about skills mix. If I read out this question, so I believe I have the right staff skills mix in my pharmacy, but I don't seem to run my pharmacy really efficiently. It always seems very busy and manic. Do you have any advice? So I think Mandy, from your background experience running Alphega Pharmacy, probably be a good one for you to pick up.
Okay, thanks, Raj. Yeah, absolutely. In addition to the great technology that there is in place now, I think the starting point for me always in a pharmacy is the type, mix of prescriptions that you get in that pharmacy. You know, historically, if you look back 20 years ago, majority of prescriptions were walk-in, patients waited, received their prescription, and the flow was pretty sort of regular in that way. Now, you'd probably say that there are three different types of prescription patients coming in. There'll be those walk-ins that clearly have to be dealt with separately. There are the repeat prescriptions, which by and large are coming through the spine, which can be dealt with separately. And then there are the MDS or the care home dispensing trays that have to be done. So the starting point for me in a pharmacy is, do you understand your mix, and what does it look like? Have you created the right flows for the patients that are coming in, walking in, because clearly people are impatient nowadays. We know that they don't want to wait more than 5 minutes if they can for their prescription. They have to be dealt with separately, in which case those patients, there's someone at the counter meeting, greeting them, taking the prescription, and it is accelerated in the dispensing process. And so walk-in patients have to be given that priority because they are waiting. Of course, you want them to shop around in the pharmacy as well, but they want to move out as well as soon as they've had their medication. The thing with the majority of repeat prescriptions that come through the spine, you can now weigh out when's the best time to dispense those. It doesn't have to be first thing on a Monday morning or first thing on a Wednesday morning. You can decide when's best. And I think touching on the technology that there is, we've got text messaging services to patients through PMR, so you can inform patients when their prescription will be ready, so that patients can take some responsibility for themselves as well as to when to come into the pharmacy for their repeat prescription. And then accordingly, what you'll do is you'll have the right staff mix for when you've got to dispense that big batch of repeat prescriptions, you know, whether it's every 2 days, whether it's once a week. That's your decision as a pharmacy. And then the third is, as I said, the care home, MDS, the trays that may or may not be dispensed from that pharmacy. Clearly, if you have the space, then you create a completely different dispensing area for them, and you try and keep them out of the operations of the walk-in and the repeat prescriptions. If you don't have the space, then you've got to find a way of mixing those with the rest of the dispensing process that's going on. And ideally, what you do is you'd actually allocate some space within the dispensary to doing that. So that's the starting point, is do you really understand the mix that you have within your pharmacy? Then it comes down to, yes, you may have the right staff, but have they been assigned to doing the right things at the right time? So if you've got trained dispensers, if you've got an ACT, are they in the dispensary at the time when you've got the highest volume of repeat prescriptions that need to be dispensed and pulled from the spine? Because that's when an ACT will be at their best, because there's a big volume of prescriptions that needs to be checked, as you do for care homes, for example, as well. So it's about, have you got the staff in the right place at the right time? But also then, have you delegated them with the right responsibilities? Because often, I think, you know, we see this quite often, and we encourage our members, have a daily huddle. Assign clear responsibilities to the team members on that day. You know, you're in charge of checking prescriptions, you're in charge for all walk-in patients coming in, you're in charge for stocking up the pharmacy. Whatever it may be, assign clear responsibilities. And I think that is a good starting point. And from that, you will then begin to realize where you can add some technology to even help you further.
Yeah, no, good. Just, obviously, you're a pharmacist yourself. Do you think that delegation is because pharmacists are scared of delegating?
It's such a
Do you
true
think? Yeah.
point. I think because when we were trained as pharmacists, you were always led to believe that that final check has to be from you as the pharmacist because it was your professional responsibility doing so. But now, as we know, there is technology to do the clinical check. There's technology to do the final check. And you have clearly trained professionals within the pharmacy who have been trained to do the final check, like an ACT. So you have to trust them. You have to trust their abilities, and you have to delegate them with those responsibilities. You've invested in them. They're being paid to provide a service to you and to your patients. And so, yes, I think a big part of our responsibility from, for example, an Alphega perspective, is to coach our members as to how to delegate. It's not always easy for pharmacists to do that. So absolutely right, Raj.
No, okay. Thank you very much, Mandeep. Really good. So I think Louise, you wanted to build on what Mandeep said there, didn't you?
Yeah, and just to, I suppose it's really interesting actually, Mandeep, you kind of categorising the different types of prescriptions, because one thing I've really observed when I've gone into pharmacies who have taken whether it's the repeat prescription dispensing or the MDS dispensing out of the dispensary into a hub environment, is there is this calmness because they're not so busy doing the administrative manual things and trying to squeeze in patient appointments and patient care and advice. There is a calmness in there which is really observed. And I've also seen, pharmacy teams who are happier and more fulfilled because they are doing what they were trained to be doing, what they love doing. So, face-to-face, frontline patient care. So it's just an observation, really, is that, some of those tasks, yes, let's get them categorised and let's allocate the right resource and time to them. But in addition, let's think about the activity that happens in the dispensary and whether it might be better outside of that environment.
Yeah, no,
and that helps with calm and
I
stress
think it's a
levels.
good point, especially coming out of the pandemic now. One could say, obviously, we're filming this in April at the moment. Where this case rises are going back up though. But if you look at coming out of the pandemic from the first 18, 24 months, I think pharmacists are getting so busy, and I think that's continued because I think a lot of people now see pharmacists as that hub of that community. So they're probably going to keep seeing their pharmacists more and more, especially when they've got difficulty seeing other primary healthcare providers like GP surgeries. So I think that busyness will always stay there. I think,
yeah,
definitely.
100%.
That's a good point. Thank you, Louise. Thank you, Mandeep. Kevin, it'll be useful to hear about your experiences in terms of automation and delegation and skill mix.
Yeah, I mean, just on that point about delegation, if you step back, it's absolutely crazy that the person that's doing the accuracy check is the person that is getting interrupted every 5 minutes with a phone call, jumping into a consultation room to do a service, and every question goes to them, and they're supposed to be concentrating on checking. So that's nuts if you step back from that. So we really do need to let go of that accuracy thing and separate it from the clinical check. But I also wanted to address that sense of the dispensary or the pharmacy being manic and busy. And as a pharmacist, I know what causes me stress when I'm checking is the sight of a queue building up, people waiting, looking at their watch, tapping the counter, all that stuff, and that creates that stressful environment. So anything that you can do to kind of reduce that, there's loads of different things. The hub and spoke thing will help because then the scripts are ready, people aren't running around putting away stock as much. But why are people in the queue? Some of them are in to buy stuff, some of them they need advice, some of them are just in to pick up a bag and leave. So we need to separate out the reasons why they're there and see, well, can we do that in a different way? So obviously collection points are one element of that because it spreads the peaks and troughs throughout the day out with your opening hours. People can come when it suits them, not when you're open. But also things around notifying patients. A lot of pharmacies still don't text message patients, and we kind of need to train our patients and manage their expectations. So basically, please don't come in until you get a notification. And using technology around that, about how we file prescriptions, the digital clinical check, all those things can contribute to just reducing that kind of stress environment. And I think it also links through to kind of workforce issues about making the environment more attractive, which we'll probably touch on later, to work in for pharmacists, I mean.
Yeah, no, I think you've got really good about workplaces stresses have actually obviously increased coming out of the pandemic as well. So I think we've all been touched upon it in terms of stresses and stuff. So that's a good point. Thank you very much. Mandy, do you want us to come back as well?
Yeah, just taking on what Kevin said, I've been so pleasantly surprised how many members now employ an ACT, checking technician. However, absolutely to that point is, are they being fully utilized for what they've been trained to do so? And it is so obvious in a pharmacy where an ACT has been given that responsibility. There's absolutely that calmness in the pharmacy. They know their role. They have a clear, and statistically, they've been proven to be far more accurate than any pharmacist checking prescriptions. So if you have an ACT, use them for what you have employed them for, and trust them to do their role well.
No, good point. Thank you very much. Right, I've got a question here from one of our pharmacy members. So I'll read out the question, and then I think, Kevin, you're probably the best place to answer this one. So in light of the growth of internet pharmacies, we all know they've been growing over the last couple of years, and talk of Amazon Pharmacy entering the market, any advice on how I should prepare my pharmacy to compete? And then building upon this, I've heard about these 24/7 prescription lockers. How do they work, and are they cost effective?
Yeah, I mean, that question was exactly what started out our journey several years ago after the pharmacy cuts. We were looking at our own group and wondering, like, do we sell up? Because the future looks a bit dodgy in terms of internet. We could see an inexorable growth of digital adoption in society in general. And so we had to decide, well, we're a bit too young to retire, so we need to fight the fight that we can see coming down the tracks. And the 24/7 was part of that. It's not the only thing. So for me, worrying about Amazon Pharmacy, it's this big elephant in the room that everyone's worried about, but it'll probably come in under a different guise. But we need to do all the stuff that they can't do really well. So for me, that's the face-to-face care. No internet pharmacy can do that stuff. Measuring somebody's blood pressure, doing vaccinations, earwax removal. That's what we need to really ramp up what we're doing in that area. And the good thing is that the pandemic has caused a step change in people's willingness to pay for services like that, partially because the NHS backlogs. They're simply not doing things like earwax, podiatry services, vaccinations have been grown massively. So there's a really big opportunity now that after coming out of the pandemic for private services that gives us as pharmacy operators more confidence to invest in that training, the equipment needed, and to do it. So that that's one thing. The other thing is, well, look at what distance selling pharmacies do well. Why are people, like them or loathe them, people do choose to use them. Why are they using them? And for us it was, well, it must be that perception of convenience. I can sit on my couch, I can order a prescription, I don't really need to do anything. Humans are lazy, basically. They'll take the path of least resistance, and we do it ourselves when we use Amazon to buy things and other websites. We want the easiest solution, and we're willing to actually not pay more almost for that convenience and that familiarity. So we need to try and match that. We can't really match the power of the big tech companies, but we need to try and give our patients that do value the face-to-face care and that local relationship, we need to give them a bit of that experience in terms of the user experience or UX. So give them a way of ordering a prescription online that they get updates of when it's ready, and they've got that convenience factor of they can pick up or get a good local delivery service, using an app, using 24/7 collection. That allows you to overcome this perception that the local pharmacy is limited in terms of 9 till 5 and 9 till 6 and half day Saturday. It's empowering the patients. They can pick it up when it suits them. Your opening hours become irrelevant then, because if they need a service, they will come in for that. But most of the time, most people on chronic medications, they just want convenience. They don't really need pharmaceutical care every time they pick up. When you can think outside the box about how we deliver that pharmaceutical care. So that was the things that kind of drove us towards 24/7 as a concept, because it really ticked both of those boxes in terms of it increased the efficiency within the pharmacy that acts as an enabler for your staff to retrain and do other things. So earwax removal, it's not a pharmacist-led service, it's a dispenser that does that. So we need to free up that half an hour that it takes to do that service, but it's generating income. So that was the efficiency side, and also it addressed the convenience side for patients. It undermined the reason we felt people were going online, and that's kind of what supermarkets did when they felt the threat of disruption. They very quickly invested in home delivery services that they didn't do before, and it kind of undermined that that disruption basically. And we need to do that as a pharmacy sector as well to ensure our kind of long-term kind of success. So that's what led us on to 24/7 collection. I mean, we like the concept. Obviously, we were a pharmacy. We just wanted to buy something that was out there, but the products that were out there, we felt they didn't fully automate the process. There was still a lot of manual scanning, and wasn't quite happy with that in terms of it wasn't fully automating things. And also the price point for us, with lots of pharmacies that are doing 6,000-7,000 items more average size, they're, the 100 grand robots were kind of out of range, and even the price point that exists in solutions where we felt a little bit bit too high. So that's why we developed our own machine basically that's specifically for the UK and how the UK works. And I think most people understand the basic concept that you dispense your prescription as normal, you get a barcode either from your PMR system or from our portal, stick it on the bottom of the bag, and then the bags, instead of going on your shelf, they just get put in the back of the machine, close the door, no manual scanning involved, and the machine basically does the rest. The person gets a PIN number, and they're told they can pick up whenever they want. If in England, where there's exemptions and payment needed for some prescriptions, patients can do that online, and then they get their PIN automatically. So basically the last of the pharmacy staff have to do is put it in the machine and forget about it, and then it gets collected, and it increases the speed of collection as well. So usually within 24-48 hours that prescription's collected. So in terms of return on investment for us, we've estimated it's about 50 to 60 hours of staff time that is freed up, and with increased national insurance, living wage right now going up, that has increased value. That's like £8,000 to £10,000 annually just on the efficiency bit, and that's before you talk about how many prescriptions have you gained in terms of attracting new people because you're offering something unique in your community, and also the thing that everyone forgets is retained. So there's this drift of low numbers of prescriptions drifting to online pharmacies. So how many of you retain because you've shown your patient, your customers, that you're going to give them that experience, so they don't really need to go elsewhere for that convenience. They're going to be able to have the best of both worlds with you. And so that's what we're trying to do with it, and that's the big payback for us.
It just occurred to me that I'm aware of some contractors who are reducing their opening hours in terms of their core hours, obviously 40 hours, and 40 hours, and then they're reducing their supplementary hours. Do you have any data showing where the pharmacies has a 24/7 kiosk, actually a lot of the pickups happen outside opening hours at all? Or
I mean, about 60% of prescription collections actually happen within open hours, so kind of surprisingly. So it's not all about 24/7. We do get some weird and wonderful ones at 11 o'clock. We had pharmacies in Edinburgh had like 10 prescriptions picked up on Christmas Day, which you would never think. But so there's some really interesting insights from that. But 40% out of hours is 40% of your customers. Do you want to alienate them, basically? So that kind of demonstrates that there's a decent chunk that do value that, and it's about them not having to rush to be there by 6 o'clock or 5 o'clock. It's in their hands when they get it. So it's empowering the patient.
I think your point is really valid. That actually, that 40% of patients who collect out of hours, if you didn't have that solution for them, would they have gone somewhere else, I guess? The key thing,
and so in our very first one, we did a survey with our patients, and there was about 20% of patients that said they sometimes used our pharmacy but not always, and they became an always in our customer satisfaction kind of survey because of that factor. So it's the stickiness of the customer, and just the point about opening hours, we haven't reduced any of ours because all of our pharmacies are standard hours contracts, and but it's something that you could tweak. Even a half an hour a day it actually adds up to, just in pharmacists alone, that's 8,000 if you can trim your hours by an hour without and while at the same time you're actually extending access for your patients. So we've got loads of different use cases. So some pharmacies are consolidating a 100-hour pharmacy into standard hours, and they don't want to alienate the patients that are used to having the access, so they mitigate that by having a 24/7. So actually they've not just 100, they've increased it in theory. So so there's lots of different kind of use cases for 24/7 collection.
Great, thank you. Thank you very much, Kevin. So our next question that's come in from one of our pharmacy customers is, what are the minimum number of prescription items my pharmacy should be doing for me to consider a robot in pharmacy? I think that crops up quite a number of times, actually. What's the minimum number? And then building on that, are robots cost effective? And what should I consider redeveloping a business case to invest? So I don't think, Louise, if you could pick that one up for us.
Yeah, of course. I mean, it's a really tricky question to answer, actually, because the minimum number of items is entirely dependent on what automation you want to invest in and put in your pharmacy. From a repeat prescription dispensing automation perspective, there are some crazy figures out there, and the recent hub and spoke consultation cited figures like 250,000 items a month, and you needed between 5 and 10 million to establish a hub. Now, that might have been the world a few years ago. And it might still be the right route for, huge pharmacies. However, with new technology coming along, there is no minimum for some types of technology and automation. And just flashing back to what Kevin mentioned earlier, that automation isn't about huge machines and huge investments in technology. It can be about taking just one part of that process and automating it or using technology to improve the efficiency. So when you look at, automation, perhaps the lightest touch is something like having a relationship with a wholesaler or a warehouse where you get patient-specific totes delivered to the pharmacy, right up to, establishing your own hub, and there is no limit to that. So I suppose what I would say to that is, I know I'm not really answering the question,
No.
that now there is no minimum item. Even the smallest of pharmacy can use technology and automation in the way they want to, and there is no maximum. The sky is the limit. In terms of a business case, of course, investing in technology it can be cost effective. It can save time, it can save money, it can help drive other revenue streams. But I would say never invest in technology without a really robust business case. So examine what is out there in the market, examine the model that's right for you now, but also can be right for you for the next 10 years of your growth, if that's what you plan to do, and understand the real return on your investment and how long it's going to take for you to hit that return on that investment. But yes, definitely cost effective, no minimum at all, and I would encourage people to go and see what's out there, because it can really improve that workflow and that process.
And do you recommend then, obviously, speaking to people like yourself at Centred Solutions, other companies, and Alphega Pharmacy offers support in terms of developing that sort of, because I think a lot of pharmacies are probably quite insular in terms of their understanding somewhat sometimes, and I guess it's talking to lots of people and getting their advice and input.
Yeah.
Because to develop a business case as a independent pharmacy is tricky, isn't it?
Absolutely. And I mean, at Centred, and I'm sure some of the other organisations do, but at Centred we work really closely with pharmacies and we help develop that business case. The worst thing we could do is advise to put in a piece of our automation and it fail because it's not right for that business. So this is about finding the right automation for the right business model and seeing gains really, really quickly and seeing value really, really quickly, because that's important. We want every customer to be successful. And I'm sure that other organisations are exactly the same. But, as a pharmacist, we're there to work with you and we're long-term partners. We're not there just to put it in and leave. So, yeah, absolutely. Talk to the people out there, get advice, speak to colleagues. There are people at different stages of the automation journey, and colleagues love to talk about, peers rather, love to talk about automation and what they've done. So, yeah, speak to the industry and speak to the experts is my advice.
Thank you, Louise.
Thank you.
Really good advice there. So I think, Mandy, you wanted to have input into from an Alphega Pharmacy point of view.
Yeah, I think there's a really important point Louise has made, which is for myself and the Alphega team, which is that I think we have a job to try and change this mindset of our members that technology is not just about big. It's not just about huge costs in pharmacy, because that's the perception we all have, that it's a big hub and spoke operation. The very fact that you can buy a small kit, or you can buy a kit that works for you, or you can just deal with single parts of inefficiencies in your pharmacy. I think that's the mindset we've now got to bring into our members, which is don't look at it as a big scale thing. It can be as small or as big as you want it to be.
No, that's a good point, actually. I think it's, like you say, mindset is quite key, isn't it? And so it's actually looking at the dispensing process and the whole workflow and how we can help support the automation. Kevin, do you want us to come in on that as well?
Yeah, I mean, for me, it's as a business, thinking about building a business case, it's the thing that often gets forgotten about is what's it going to cost you to not invest? What's the opportunity cost? And everyone forgets that. It's about, well, okay, I can get a return on investment if I get X number of new scripts because of this efficiency. Well, what are you avoiding losing? What are you're retaining your market? How many patients otherwise will drift away from you because you're not providing that efficiency or service level with prescriptions, or providing the kind of services that they need for their healthcare of their family. So there's that bit to remember as well. And the other thing that's really important that is on the horizon for pharmacy is this, we touched on it earlier, the workforce issue of we need to make the environment of a community pharmacy more attractive to work in for pharmacists, because there has been a massive migration to other sectors like PCNs, and we can obviously complain that there's a really unlevel playing field there in terms of the funding that PCNs have been given, but the reality is that's not going to change anytime soon. So it's incumbent on us as pharmacy owners, if we want people to work for us that have got skills, that we need to make it more attractive. So they went to uni, they qualified, they want to do clinical stuff more than, process. Basically, most of them do anyway. So it's about creating that environment, reducing the stress levels, giving them opportunities to use their clinical skills. We've got loads of them now. There's funding even in England to do independent prescribing. How are they going to be able to use those skills? It's not just a case of train them up and off they go. We have to create the environment that is not stressful, it's attractive, and it is enabling them to spend time in the consultation room and not be worrying about the queue of patients. So that's the bigger part of the kind of business case for me. It's not just about that, and it's just about talking to your peers. I think, to be honest, a lot of it, certainly independents I've seen, and myself included, we're probably just as much influenced about what our people that we respect are doing in the market. In terms of, we see there's trailblazers out there that are kind of out ahead of others. So you watch what they're doing, and you kind of speak to them, see how they're getting on with it, and then people tend to follow suit, and that's just the nature of technology adoption. It follows that kind of curve, basically. So you don't really, there's early adopters that are just trailblazing, and then there's a kind of early majority, and then it becomes mass adoption. You don't really want to be in the laggards kind of group where you're basically having to adopt the technology because everyone else already has. By that point, it's kind of too late.
No, good. Thank you very much, Kevin. So our next question comes from a small pharmacy in England. What he says is, I'm finding it hard to deliver services. There have been a number of launches recently under the Advanced Services banner in England. What am I doing wrong? Can you give me any advice? So Mandeep, it'd be quite useful to see your feedback on it, especially from an Alphega point of view.
Sure, Raj. I think, 20 years ago, Raj, you and I, we were talking about services being the future of pharmacy. You've got to embrace service. Well, that future is now. Let's be honest. Services is not a nice to do thing. It's not just an add-on in your pharmacy. It is very much a core component of your contractual service to patients, but also your income. And just touching on, Kevin said earlier, you have your early adopters, then you'll have those who'll come along. I think with services now, you just have to accept that this is going to be part and parcel of what you do in your pharmacy. So the first thing I would suggest is try and segment the type of services that you are providing in your pharmacy. You have those that clearly may require an urgent service being provided, let's say an NMS, patient walking in, and you have to grab that opportunity. Then there will be those that you can schedule. You can put an appointment system in. Why not? At the end of the day, that's what we do when we go and see our GP. So you can schedule in some services, and flu being a great example of that. And then you may have some services where genuinely you as the pharmacist are not needed throughout that whole service in terms of providing that service. There are services that you can allow your pharmacy team colleagues to be able to provide, or certainly they can do certain elements of that service. The more administrative tasks, for example, taking down the patient details, as it were. So it's trying to understand how you want to run those services in the pharmacy and segmenting them in that way. And then it's about how you're going to proportion your time. Bear in mind that if you've invested in the technologies that we've been talking about, you're not needed in that dispensary 24/7. You've got the clinical check technology. You've got the final check technology. So you as the pharmacist, you can have that clear headspace to put yourself in the consultation room uninterrupted. And it's really important that it's uninterrupted, because no patient ever wants to be interrupted in a consultation room when they're with the pharmacist, because the pharmacist is being asked to come into the dispensary to check a prescription. So my first thing would be try and segment the types of services that you have. And there are some great services that are now coming into funding. I mean, Scotland have been leading the way. Wales are now taking, and it's coming into England as well. We've got the hypertension finding service. There's good money wrapped around that service, and it would be an absolute shame if you didn't proportion some time to providing that service to your patients. It's relatively easy to do. Identify those patients that fit in that criteria, and then you've got that extra layer of income for an ambulatory service as well that you can provide. So it's an absolutely essential component of your daily routine in the pharmacy, which is how much time are you going to put aside to providing those services, create the necessary processes in the dispensary to free you from doing those, but then put your time into those services where you as a pharmacist are needed, and get your team around you to help with the other elements of providing that service.
No, good. So just building on that, Mandy, it just occurred to me, technology is quite key to help deliver that time saving. And I guess, and I was saying from an Alphega perspective, there's lots of things we do manually, paper-wise, that we're looking at. I know you've got a SOP manager that you recently launched, but I guess it's embracing that. So when we think about technology, is actually a digital tablet, getting members of staff to send emails to patients within GDPR regs to fill in questionnaires. I guess that's quite key as well, isn't it?
Absolutely, and we've always been encouraging members to have a system in the consultation room so that they can directly input into it, especially when you're submitting services for reimbursement, for example. But you're right, alerting patients through a text mechanism or an email mechanism, obviously providing it's within GDPR regulations, using that technology. And clearly a lot of services now are linked to technology, because you'll have blood pressure monitors that can be linked to computer systems. So harness that, use that to the best of your ability, because you will save a lot of time as well. Thankfully those days are gone when everything had to be filled in triplicate, before you could even do a service with a patient. So a lot of time has been cut down in the administrative tasks for providing a service. So really, your role as a pharmacist then is to have that direct intervention with the patient when it's best needed to give the patient the advice about the outcomes of that service that they've had.
So talking about being hard to deliver services, I think, Kevin, from your perspective, you've got something you wanted to add to that, didn't you?
Yeah, with my pharmacy owner hat on, I mean, we're in the same boat. We're innovating, but change is difficult. Changing, you still have to do the day job of getting prescriptions out the door, and change doesn't happen overnight. So you can't be too hard on yourself, but you do need to start somewhere. And the other thing I would say is we absolutely need to show the NHS that we're able to provide these services and we're going to embrace them, because our negotiators cannot credibly go to the government and say, give us more money for other services, when we haven't demonstrated that we haven't delivered hypertension case finding services. We haven't done the NMS. There are lots of people that don't do NMS still. The catch-up NMS was a massive opportunity. It was hard. It was, the way some of these services are announced, we're not really given enough notice, to be honest. It's like the hypertension case finding service, it's going live tomorrow and nobody has an ABPM monitor. It took months to get them. That's ridiculous, and the NHS should treat us with a bit more respect than that, to be honest. But we do need to embrace them and demonstrate that, yeah, we are able to do that, and we are another option for them to manage the population health. And particularly now, what's also going on in the background with the change to integrated care boards and how commissioning of healthcare services could completely change over the next couple of years. We need to be putting our hand up and saying, we're an option for managing population health needs, because we've got this massive network of clinicians, like walk-in centres, I call them walk-in centres on the high street. So we need to embrace them. So we have to find a way as a sector if we want a healthy profession going forward.
Our next question for the panel is a good one. It's a medium-sized pharmacy chain that have asked a question. There must be ways I can utilise technology to make it easier for my patients to use me. Any advice? I think Kevin, obviously from your background, that'd be quite useful for you, obviously being involved in a medium-sized chain. Yeah. You can pick that one up.
Well, for me, it's, there's a bit of a buzzword that goes around, like being patient-centric, patient centricity, putting yourself in their shoes. And it's actually quite hard to do that, because as pharmacy operators, we've got blinkers on. We know why the system operates the way it operates and the length of time it takes for prescriptions to come and all that stuff. Patients don't know and they don't care. They want the convenient service, basically. So you do have to kind of really try hard, consciously, to step out of that mindset. Try and forget everything you know about pharmacy and look at it with fresh eyes, and or ask people in your family to try and do that. So if you compare it to if you bought 3 items of clothing from a shop and they didn't tell you when it was ready to collect, and when you went to collect it, there was only 2 of the items ready, and you had to make another trip the next day or 2 days later to pick it up again. Would you use that shop again, or would you look for another one that maybe gave you a better experience and kind of kept you posted about when your items are ready and was consistent and you didn't waste time? Everyone's time poor now. Patience has gone down a lot, I think, as a result of the pandemic. People, they value their time a lot more. So that's the kind of mentality you kind of have to approach your service. So thinking about your user experience that you're giving people, you've already kind of covered this in the previous series about branding and having that digital front door for your pharmacy. So make it really easy for them to use your service, find out about your services online when it suits them, when they're sat on the couch on a Sunday evening. So you need to have a decent website that they can order prescriptions on, or an app, or browse your services and book an appointment. So that market is maturing. There's a range of pharmacy apps, patient-facing apps that are maturing, and it's hard to know which one to hitch your horse to that wagon, basically. And obviously you can lean on your membership groups like Alphega, who do some of that hard work for you in terms of figuring out what the good solutions are. So use that, speak to colleagues. But yeah, it's about providing that sort of digital end-to-end service and thinking about user experience for me to make it, because the question is about making it easier for people to use you. So that's an important piece, and it's going to grow. So it's just going to continue to grow. The proportion of your customers that matters to is going to continue to grow. I know there's the vast majority of your customers right now are 60, 70, but that's kind of changing. Most 60-year-olds now are iPad users.
Yeah, they are.
That 10 years ago, people would say, yeah, but 80% of my prescriptions my prescriptions come from elderly people, and they don't even have a phone. That's not the case anymore. Everyone's got a phone, whether even smartphones, never mind just basic phones. So the world has moved on, so you kind of need to move with that.
How do you find, so a follow-up question for myself really, how do you find bringing, obviously having a medium-sized pharmacy chain, even if you've got 10 pharmacies, you probably have 5, 6 staff, at least 50, 60 sort of team members really. How are you finding bringing them all on that journey? Is it difficult? Is it easy? Or are you progressively sort of one of the early adopters and that's instilled in the pharmacy teams? How are you finding it?
No, it is difficult, and I think they like working, knowing that they're doing something innovative, and you need to reinforce the positives that have come out of that change, because this is a cliche, nobody likes change. So you do kind of have to bring them with you, and with automation, it's a thing, especially for the wider team. People think about robots and they think about job cuts almost, and that's really not, for me anyway, and for most people I know that have automated, it's not about cutting staff. It's about being able to use those staff to do more valuable tasks, and being able to grow without needing loads of more staff, because that's just not business. It's not viable from a business point of view. So it's explaining that. Once you kind of that helps overcome some resistance, and then reinforce the positives that they're getting out. Pointing them out, celebrating the wins that you've had from implementing a change. Even something as simple like in our group about location tracking where the bags are stored. So nothing to do with collection points, where they're stored on shelf. That was quite a big change in terms of how we file prescriptions. But once you did it, people, it was celebrated how good it was, and if you tried to take that away from them, they would say no way. I can't imagine going back to the old way of looking for prescriptions. So that's you need to kind of celebrate those wins, and then that helps the next conversation.
Louise, on that bit about medium pharmacy change and mindset, have you got any views on that?
Yeah, I mean, a medium kind of chain is ideal for the kind of centred and the Flow RX software and solutions that we offer, really. And just to kind of give that some context, I suppose, is that as a medium chain with, 10 pharmacies or 10 branches, what the technology can do now is it can enable you to pick patient-specific totes. So the interesting bit about this, and people always go, well, what is that? And it's got very different names out there in the marketplace. But this is, rather than your pharmacist walking around the dispensary 30 times, one patient picking it up, another patient picking it up, our technology enables you to kind of pick for 30 patients at one time. So you're not wearing out the leather on your shoes 30 times, you're only doing that once around a dispensary. Now, that can mean, for a chain of 10 pharmacies, if you centralise all of that repeat prescription dispensing, think about the amount of activity that's taken out of that dispensary. And then technology can also, not only does it pick those patient-specific totes, it can also then help label them. There are labelling solutions out there that can label 1,500 packs an hour, 25 packs a minute. So there's speed put into the dispensing process. And then there is automation around the sortation of patient prescriptions, and then the bagging and the packing. So there are so many different elements. If you think about centralising and pulling together your repeat prescription dispensing from those 10, if you do have the physical space to set up a hub, there are massive efficiencies in there that can be really realised, and a medium-sized firm is perfect for that kind of model.
So my next question to all the panel is, so how long is a piece of string? I'm joking. So what is the future of community pharmacy from your perspective? So Louise, is it right if you kick off, please, on this one?
I think we've probably touched on this in a number of ways. I think, without doubt, the model of pharmacy is changing from that of a traditional dispensing model to one of providing more care services. And for this model to be truly successful, we've touched on we need more locally commissioned services to make that a real success for local pharmacy today. I think one thing that has come into a kind of acute focus is the role of the pharmacist in local community, particularly in this health crisis, and not just during the pandemic, but also in, the role that pharmacy has in the future of healthcare provision in the UK particularly. And I think pharmacists will continue to step up, adjust, and address these issues and embrace technology whilst doing it. And I've no doubt at all that pharmacy will embrace technology. Particularly as they are being asked to do more for less. They'll have no choice, and that choice will be removed to a certain extent. But also with the pressures on staff recruitment and staff retention, pharmacy time is more valuable now than it ever has been before. And quite right, pharmacists should not be constrained to the dispensary. They've trained long and hard to do what they do, and they play a really pivotal clinical role in their local communities. So, from my perspective, working with pharmacists, and I think I've no doubt that pharmacists will adapt. There are many pharmacists are entrepreneurs, and there's some brilliant business minds out there. And I think pharmacists will really rise to the challenge. And I think they'll take that pole position in terms of the delivery of healthcare that they've perhaps not had, for some time.
Well, great. Thank you very much, Louise.
No problem.
Same question to you, Mandeep. So I know you've been a pharmacist for many years now. What do you see the future of community pharmacy going forward from your perspective?
I think it's a very exciting one. When I first qualified as a pharmacist, the first patient I ever met was the first day of my pre-reg. Nowadays, pharmacists or trainee pharmacists at university meet their patient in the first year of their university undergraduate program. So we owe it to these pharmacists to allow them to have that clinical interface with patients, to provide those services. I know how daunting it was for me to provide an MUR because I'd never really had that sort of training in dealing with patients. And equally, patients were quite reticent about why is a pharmacist asking me to come into a consultation room for this service. Whereas now, the last 2 or 3 years, particularly the pandemic, has really cemented the role of pharmacy. 3 years ago, even vaccination services was something that was considered quite an alien thing for community pharmacy to be doing, whereas now it's just accepted, it's a given. So I think the future is really exciting because we can now have that opportunity for pharmacists to have that clinical interface with patients, to provide services. Yes, we still have that question mark and debate about how we're going to deal with the volume of dispensing, but clearly the whole discussion today has been there are so many good tools, automation, systems out there to help with that. Legislation will hopefully change as well to enable that. So I think the future is very exciting. There are so many new services that pharmacists will be able to provide as well, in addition to the ones that are already established. So I'm quite excited for the future of pharmacy.
Thank you, Mandeep. So Kevin, it'll be useful to get your perspective, only having foot in Scotland and in England. So where do you see sort of the future of community pharmacy from your perspective?
Yeah, I think it is in a much better place post-pandemic than it was going into the pandemic. Certainly in England, Scotland is way out ahead in terms of the direction of travel is very clear. Every pharmacist is going to be an IP within the next couple of years. They're going to come out of uni in the next year or two, and there's funding there to do that. So there's funding now in England, but there isn't any business model to use that IP in your pharmacy in England. And that's a major problem that needs to be addressed, because at the moment we're trying to figure out private services and private ways of being able to ultimately pay that IP more for their enhanced skills. There needs to be an NHS model where they can take on some of the prescribing burden of minor illnesses and other caseload. But the future, future pharmacy, I think is more of a well-being centre. It's why we call our company Wellbeing Pharmacies at the way back 15 years ago. Looking into the future. So it'll be a place of healthcare services that also dispenses prescriptions, and that's what we need to become. And frankly, some of our premises aren't really up to that. We probably need to make bigger premises, more consultation rooms, to produce, to create that clinical environment. We need to do that. We can't have consultation rooms that are packed full of cardboard boxes and things like that. We need to have that clinical feel that patients expect. And you touched on people qualifying now. They're getting better training essentially. Coming out of uni, more patient focus, more patient contact time. The people that are coming out of uni now, they were born in the year 2000s, which is kind of makes you feel really old. They're digitally native. They're not scared of using new technology. We need to kind of enable them. And I guess the challenge for pharmacy owners is a lot of the decision makers in pharmacies, we're a bit older. So this is kind of
yourself me and Mandip still young, I think.
We're young at heart, but we're kind of not as digitally native as these people, so we kind of need to take a lead from them a little bit, not be too scared to kind of take a plunge and use some, do something new, do something different. But yeah, it's a good positive future. I'm pretty positive about the future of pharmacy.
Raj, I think Kevin makes a really important point in that the whole funding of independent prescribing pharmacists. I went to see some members in Scotland, and it was so refreshing to see them using the IP accreditation in the community pharmacy to help patients who clearly couldn't see their GP. That has to happen in England and Wales, as Kevin says, and at some point in Northern Ireland, because what we don't want to do is lose these highly trained pharmacists to go and work in GP practices, and then they're completely lost to community pharmacy. So I think it is critical that there is some support through the IP program in community pharmacy.
Yeah, no, it's a good point. I think we certainly have seen feedback and reports that actually some really good employed pharmacists are moving into that sector, i.e. GPs and PCNs, because of that attraction. So you made a really good point. Let's utilise their skills if we can and get a remunerated service. Our final segment really for today is what is the one takeaway message each of the panel would like to give to the audience? And actually, as a result of listening to you today, what's the one key action you would like the owner, the pharmacist, the pharmacy team member listening to you today to go and implement when they go back into their pharmacy? So should we start with you first, Mandeep, on those two questions?
Yeah, absolutely. So the take for me is that there is so much now available to help community pharmacists in bringing more efficiencies, in bringing automation, in taking away some of those areas of workload that perhaps historically they could not reduce. So use that technology that's there, embrace it, try and understand it. Meet with companies like Centred Solution, with MedPoint, to see what they have to offer. It's clearly working in a lot of pharmacies. So my take for me is that there is so much out there to help independent community pharmacists. I think for me, one action, and this is what we really encourage our members to do, is just take some time away from your pharmacy, be it a few hours. If you have the luxury of being able to employ a locum during that time, even better, and just take a helicopter view of your pharmacy. It's a bit like having a drone on your pharmacy, and just look at all of your processes with a fresh pair of eyes. How's your dispensing going on? How are your patients being treated as they come into the pharmacy? Where are your tote boxes lying around in the dispensary? Are they not? How's the consultation room being used? And bring a fresh pair of eyes, and for every element of that process within the pharmacy, how can you simplify it? Because we know there's so much more bureaucracy in pharmacy, there's so much more paperwork, there are so many other duties that have to be performed, but a fresh pair of eyes in your pharmacy, and look at wherever you can simplify some processes, is what I would urge every pharmacist to do.
Great. Thank you very much, Mandeep. Louise, so Britt, coming on to you now, really, same questions. What's the one key takeaway message you would like the audience to take away from what you've said today? And what's the one key action you would like, again, the pharmacist, the pharmacy owners to do when they go back into the pharmacy?
Okay. I think it's really simple from my perspective. It is, hub and spoke technology or repeat prescription technology or any automation or technology comes in different shapes and sizes. So there are solutions out there that can fit you regardless how big or how small you are. And so I suppose that's my key takeaway, is that automation and technology is a lot more than it used to be some time ago. As far as the one key action that I'd like pharmacists to do is keep an open mind about automation. It's not just for the big players anymore. There are options out there for everybody. And keep an open mind about the hub and spoke consultation. It's not as it was some time ago. There are options out there again for everybody. And be on the front foot of change. I think Kevin mentioned earlier the consultation is going to happen and change in some form is going to happen. Be on the front foot, go out there, explore your options and be ready and see the change that you want the market to make.
Right. Thank you very much, Louise.
Thank you.
So Kevin, from your perspective really, from what you said today, what's sort of the key messages you want to sort of summarise to the audience today? And what's the one key action you would like someone who's listening to you today to go back and sort of do when they go back to their pharmacy?
Yeah, I mean, for me, one of them would be try and shed the preconceptions that you might have around what automation is. Some of our pharmacies just didn't either have space or they weren't big enough to have a 100,000 plus robot in them. So we looked at other ways of automating, and obviously unusually developed our own machine, but like I said earlier, there are other ways to automate processes and workflows. So that's one thing. The other key takeaway message, I guess, is it can be overwhelming for an independent contractor to kind of know where to start, because there's so much change happening, so many challenges, so many opportunities. So I would lean on membership organisations like Alphega, who they go away, spend time and figure out some of these solutions and recommend them to their members. So pay attention to that and let them do some of that legwork. And the real thing is just start somewhere, start small. There's a saying that you don't need to be great to start, but you have to start to be great. And I kind of try, when I read that a couple of years ago, I kind of try and keep that with me, because there's so many things that you see that, well, that would be good and that would be good and I should do this, but you don't actually make it, start doing them. So, instead of letting this be yet another webinar that you listen to, actually get some action on the back of, just do something, and it may or may not work, but at least you're doing something, and build on that. Great.
Thank you very much, Kevin. So that's it then. So I just wanted to really thank our panellists, our expert panellists, so Mandeep, Louise and Kevin, for attending today. It's been fantastic. So this has been a fantastic Reset and Revive discussion panel with Alliance Healthcare in association with Alphega Pharmacy. And the key question we've discussed today is, how can technology be utilised to support the workflow of a pharmacy? So please do listen to our expert speakers today. Both Mandeep, Louise and Kevin gave some great practical tips, advice, some actions to take away into your pharmacy. Catch up with you all soon. Bye.